Hi, this is Dr. Nina Naidu. I'm a board-certified plastic surgeon in New York City, and today, continuing with breast implants, I wanted to show you again the silicone breast implant. The silicone breast implant has such a difficult and maligned history, but in reality it's a very well-studied and a very safe device. There's a reason why silicone has remained so popular, and it's just that nothing else feels like silicone. It is so soft and so smooth and truly feels like natural breast tissue when you touch it. Silicone implants are also very durable. You can really put them through a fair amount and they will not rupture. They have a very low rupture rate, and in general that rupture rate starts to increase at about 10 years when the implant shell begins to wear out. So this is a silicone gel implant, meaning that both the shell and the gel inside are made of silicone. Now, this is a regular silicone gel implant, meaning that if I cut it, it'll kind of spill out all over the place. It'll just goo a bit all over the place. It won't spread all through the body if it does happen to rupture within the body, because your body does form a little protective capsule or shell around it once it's been placed, but it's not the gummy bear implant, which we'll discuss in a different video. So this is a typical silicone gel implant. This is a very pretty implant. This one's made by Sientra. It has, as you can see, a nice smooth top to it. It feels completely natural once it goes into the breast. It's a beautiful implant. So the benefit of silicone, obviously, as I've mentioned, is that it's very natural, it feels wonderful, it looks great in the body. Also, when you put it up on the side, you see it really doesn't have a tendency to ripple. It just tends to stay nice and smooth when it's in the body, and you really notice that. So that's a big benefit as opposed to saline implants. The other thing is that it has that smooth round shape, and so it does give that nice natural shape to the breast. One of the downsides of silicone is, as we mentioned, rupture. Every implant can rupture. The downside with silicone rupturing is that you don't always know if it's ruptured. Sometimes patients will have pain, sometimes they'll have a little bit of redness on the breast. They might notice a little bit of a change. And a lot of times the rupture is completely asymptomatic. So for that reason, the FDA recommends that patients get an MRI every 2 years following their breast augmentation surgery, starting at 3 years out and then every 2 years thereafter. In my own practice, I like to bring patients back every year to have the implants just examined, to just have their breast examined, make sure everything's okay. If there's any question, then I'll send the patient for an ultrasound or an MRI if there's any confusion or concern on the ultrasound. One of the disadvantages also of silicone implants is that because they come pre-filled, they're of a set size, so you need a slightly larger incision to get through the incision into the breast. So for example, for this implant, which I'm going to show you, is a 325 cc implant. It's a 325 moderate plus MP, moderate plus implant. It's a beautiful implant, as I said. And to put this in through a small incision can be a little bit tricky. With a lot of practice, definitely a lot of surgeons, we've become very good at it. There's also something called the Keller funnel, which I'll show you on another video, which we use to propel the implant very gently into the breast. But in general for this, I would probably make about a 4 centimeter incision in the breast to get the implant in. As opposed to a saline implant, which as we saw, you just can fold up and put in, you can use a much smaller incision. So those are really some of the benefits and downsides of silicone gel implants. I am a little bit biased, I'll admit. I really do love the way that silicone feels and looks in patients, but we do have a lot of really good options for patients these days, and I just wanted to present this one to you. So in the next video, we'll talk about a new implant called the ideal implant.